Thank you. The idea is to introduce a conference that will later be given by Dr. Carlos Aguilar on the agenda of nutritional prevention of diabetes. He's the expert in this subject, and he has done a lot of work, clinical as well as epidemiological ones, and he has been one of the leaders who will next week present the result of their works at the Medical Academy. So he's the one who has to take on this subject. I'm only giving the introduction. He thought that it would be good for me to speak about nutrition and diabetes. And this was what we agreed upon. But in Spanish, nutrition has a meaning which is completely different to the English term, which is nutrition. In Spanish, nutrición or nutrition is such a wide phenotype and result that it includes feeding, genetics, epigenetics, the physical and psycho-emotional, social, cultural environment, and is a constantly changing scenario. Thus, diabetes is a nutritional disease, and this institute was called the Hospital of Nutritional Diseases in 1946 because he treated things like obesity or diabetes. And in this sense, it's a nutritional disease. But I won't go into further aspects. And I will let Carlos to speak about the biggest part of this subject, but I will introduce some reflections. The literature on prevention is very diverse, but there seems to be an agreement that several changes in the lifestyle in healthy and people at risk are efficient. But beyond that, beyond experimental conditions or temporary or short-term conditions in short groups, we ask ourselves what has been the success if obesity and diabetes is increasing in many parts around the globe. And Mr. Ernestina Polo, who organizes this conference, created a group at Fund Salud to make a proposal adequate for Mexico about the supplies of public policy to prevent diabetes in the population. And this started in August 2014. We have only had some meetings, and we have only created a draft, which is more or less the following. Lifestyle interventions tell us that in order to reduce glucose intolerance and type 2 diabetes and comorbidities, we have to have a healthy body weight, and we should emphasize that if there is obesity or overweight, it has to be reduced, and thus 5 to 7% of the body weight can be reduced with a low-calorie diet and a low-fat diet, which will allow to reduce body weight and the risks. A healthy diet, which can be defined in many ways, and regular physical activity in a program which is well structured and organized with follow-up and sustained control is what we need. Obviously, it is also important to eliminate smoking, reduce alcohol intake to a minimum, and to increase much the intake of vegetable and fruit and of water. Diets including 2 to 2.5 kilocalories per gram with less than 30% of lipids and less of 10% of saturated fats, less than 10% of sugars, and with a high fiber content of more than 15 for each gram per 1,000 kilocalories. This is a Mediterranean diet, but which formerly was much similar to the Central American one. and which is much close to what we eat. I think that any traditional diet, which is not a Western diet, could provide the same result as the Mediterranean diet. But the latter one was studied first. The cross-discipline group consists of all these people, and there are many institutions involved, many specialties involved. It is profoundly a cross-discipline team. I won't read all of the names, but the written version of this presentation will include them. The diabetes prevention group I'm speaking about created a series of principles which I quickly will summarize in 2 or 3 slides. One, even if diabetes, obesity, and hypertension are separate, but they go so much hand in hand that in practice we have to avoid hypertension and obesity. Next, since I insisted, and it's nothing new, even if it seems so, is that we have to create an integrated solution. The problem is a complex one and this much trivialized. And the issue is that we trivialize it with simple solution biased folky, and this leads us to a lack of success. This morning we spoke about a systemic approach. What Dr. Lee said is also applicable to what I'm saying. In the first part, we have to use a systemic focus. And we have to consider all age group and socio-economic groups separately. In other countries, the socio-economic aspect is not as much different as it is in Mexico, and this is essential for us, as well as the enormous differences between rural areas and urban areas. Prevention, primary prevention and secondary one, and also to grant access to health services. In Mexico, it doesn't cover a lot and not necessarily with quality services. The adequacy of recommendations have to be considered, as well as the characteristics of production availability and consumption finally of local food. We spoke about the Baltimore experience, where it seems that supermarkets and the policies are decreasing. In Mexico, we have much better experiences, and there are markets which have functioned for thousands of years that come for the buying process a sense that we cannot find in supermarkets. And there are also people who mentioned that the presence of supermarkets has altered the food system. We also have to put attention on price, availability, and consumption of food. And we have to think about different actors. And this is a proposal which some of the members of the group made for young people, because the teenagers from 15 to 20 years old know much about the media. They have much time available, and they could be actors who could influence on change in society. There's much information produced in our country, but the data available and useful in the Mexican population are only few. And I think among the proposals for research, these last subjects should be treated. Another principle, which is an old one, and Dr. Monzafarian spoke about it too, it's obvious that we cannot only consider nutritional elements. What we have to consider is the diet as such, and everything else, the primary food and industrialized or processed foods are not part of should not be part of nutrition. We have to speak about how we eat. somebody yesterday spoke about the French paradox, and they have a high intake of saturated fat, but they focus their food intake differently than other Western societies. So, but what is different is the respect they have for the act of eating, and therefore the results are completely different. And I think this is a principle of the Mexican Nutrition Institute too, like with Subiran and Federico Gomez. They spoke about that, so this is nothing new. So we should also rescue the traditional Mexican food culture. I already mentioned the Central American diet, and there's much literature existing on this subject. And this is what we lost with globalization and extreme urbanization that occurred 30, 35 years ago, and where clearly in Mexico the epidemics of obesity and diabetes and other diseases started. And this is a terrible loss, because food is a habit of traditions more than one of knowledge. Teaching or speaking about calories or fatty acids and physiological value. It's only interesting if somebody is interested, they can tell them, but it won't help people. But achieving healthier habits would be very important. As a matter of fact, you ask people, and they know how you have to eat, but they don't do eat well, and they don't do it because it is not as simple. It's a thing of habits, of tradition, and our traditional food habits depended on too much. But 50 years ago, people had some of the problems we are having now. The theory of food taught people how to. It's not possible to learn how to cook well if you don't cook well. On the other hand, it's necessary to use health as a value that has to be built permanently. The Mexican norm 043, which was created in 2005, and whose standard is the well-combined dish, which in my opinion offers much more information to return the culinary capacity that has been lost with the various eating habits we have now. And this is perhaps a commercial argument, because oftentimes people say they don't have time, but I think people have more time than they say. The marketing, which is also terrible in our country, and the lies involved in all ads should be changed. We should prohibit that children of a certain age should not be exposed to this. And what these ads say, they confound people, and people are also obsessed with a series of concepts which do no good. And also, young people should be actors, and we should work on the traditions at home, not involving too drastic changes. And this is what I wanted to think about together with you before giving the floor to Carlos Aguilar for him to present the Mexican agenda to you. Thank you.